you know, because I've seen with the new introduction of Sculptra, for example, now, and before that, Elancé, that produce collagen, it could be very hard. This is a product that allows you to repopulate the area of depression with the body's own fat. So that's the beauty of this product. Forward, okay. So what is Renuva? Renuva is an off-the-shelf injectable allograft adipose matrix. Basically, so we're bringing the adipose matrix from another person, you know, being, you know, like basically any allograft material, and putting it back in. And where do we use it? It can be placed anywhere where there is fat. So we're not gonna put it to recreate bone, we're not gonna put it to recreate muscle, but anywhere the skin gets thinner or depressed, we can put that product to repopulate it with fat cells. And fat cells in the right place are good because, you know, a padding, you know, like now you're sitting on a table. If it is just the, you know, what you see, the blanket there over the table, and it's like raw wood underneath, you will see any irregularities. So the padding underneath that nice table cover would be a good thing to do. Same thing with our skin. All right, so normal fat cells are like this. Basically, so we have all the extracellular matrix, and if you see at each fat cells is the membrane with the nucleus or whatever we want, and then the fat is deposited right there. When we take this material, and this is how we see it, so everything that's outside looks like hairy material, is the extracellular matrix we're talking about. That's what Renuva, we will show you how it is processed. And basically, the fat lobules are within each cells. So when we take these fat lobules, and these lobules, whether it's collagen 4 or 6, and if we think of a bubble wrap when you buy a toy, or, you know, when you get something out of packaging, you know, Amazon or whatever is now delivering to the house, there's bubble wrap. When you pop all of them, you know, and what's remaining is the extracellular matrix. So basically, if we take the fat cells and we process them out, and what's left is, you know, condensed without the air inside or without the fat cells inside, that's why we're talking about the Renuva. So in that extracellular matrix, there is precursors to recreate or absorb or bring into the area where injected the fat cells. First, angiogenesis, and there's angiogenesis and adipogenesis. So angiopoietin or endothelial growth factors, all of these invite blood vessels to come to the area. So it's like precursors of basically growth factors. And these are adipogenic factors. So these angiogenic and adipogenic factors are still remained or retained into the extracellular matrix. So when they get injected in a depression or into an area where we want, you know, homogenized fat to come in, and we will demonstrate that in a second, not only fat gets deposited, but it's also get nourished with blood vessels that are being injected. So think of the honeycomb. So basically we have a pre-made honeycomb that we're putting in it, and then we are inviting the bees to come and fill the comb with honey. So basically we are putting an empty one, and then the fat cells will be deposited after that. So basically this is what Renuva is the honeycomb or the matrix without the fat or without the honey for the bees. And when it comes in, the body will fill it in because the growth factors are already there. So the signals for the body are there to be coming and filling in. So basically, this is it injected blank, you know, magnified 1,000 times. At 7 days, we start seeing deposits of fat lobules, and at day 14, and it continues for up to 2 years. All right, so 3 weeks, barely anything, just very dense material. At 6 weeks, we start seeing fat cells populating the area. At 12 weeks, and then when we go also at 12 weeks, we start seeing blood vessels, because we said there's adipogenic factors that are inviting the fat cells, and there's angiogenic factors that are inviting the blood vessels. and it will become a live tissue. So Kukai published in PRS something done on the human on the mouse and on the human, and it did demonstrate basically what we've seen. And then Dr. Khoury and Roger Khoury down in Miami and Sidney Coleman, they injected the dorsum of the wrist, this area right there, 15 patients, and to see whether it's safe, whether the volume is short-term or can be also long-term, up to 16 weeks. And they did the stain, which is perilipin, and this is basically what they injected. This area originally, this is immediately after, and coming back later on, you see that there's some filling of this area. So this was just a study, it's not a permanent treatment. And the stain, which was done at 16 months, which is a year and a half almost, it shows that the fat cells continue to be present even at 16 months. All right. The study that's showing how much of that, so if you inject 2 cc's of extracellular matrix, so would the body absorb it, or what will happen to it? They have realized that the volume is doubled. So if you put, let's say, 2 cc's of extracellular matrix at 12 months, at 16 months, or even at 2 years, it's doubling the effect. So you expect 4 cc's of extracellular matrix with fat that is invited into that area. This is the same dorsal study, basically showing us that there's no adverse effect. There's minimum redness in 2 to 4 weeks. With massage, it gets better, and then with the biopsy, that it is vascularized. And basically, why are we doing it for the dorsum of the hands? For younger women, that shows that their hands are very prominent veins. The tendons are showing. Or with aging, the same thing happens. So it's the veins and the tendons get more camouflaged out, rather than sometimes when we do fat transfer, we see ladies walking around with a bump, with fat transfer, bumpy hands. So this is an interesting thing. This is an interesting study. They took, somebody who has planned abdominoplasty, is going to have his abdominoplasty in 3 months or so. They went in and they injected Renuva into the area, and they're going to cut that pannus out, or that skin out, and they will study it. So this is a pre-planned study, basically. So they injected a big bolus rather than small bolus into the abdomen, and then they removed it. And then it was systemic local injection. They checked if there's any adverse effects. They checked by ultrasound what's going on. And finally, they cut that skin out for the abdominoplasty, and they studied it histologically. And they realized that originally, when they took a biopsy, it's just a dense extracellular matrix. Basically, it looks like a filler, basically. But with time, this is originally, it's just a very dense bolus of Renuva, okay? And then at 12 weeks, it's still there. Only the periphery is populated with fat. At 24 weeks, so this is 3 months, this is 6 months, much more fat has come in. So basically, it was only this is at 3 months, coming in fat only in the periphery, so it's invading or it's populating from the outside in, and this is where, at 6 months, when the operation has been done, the whole bolus area has been populated with fat. And it's not like a big lipoma tumor, rather than the matrix itself, like the honeycomb, has been populated. All right, so this is the study that's showing us adipose infiltration, angiogenesis, because it becomes a live tissue with no adverse effect, or minimum just redness or hardness at the site. A temple study was also done. Instead of putting fillers, you put the extracellular matrix and it gets populated with fat, and it's lasting over 24 months. This is 10 patients, foresight by Gold. And, it shows cluster of adipocytes present at 8 weeks, and, taken all the way up to 24 months, is still present. Perilipin is the stain that was used, and shows presence as early as 8 weeks and as late as 6 months, 12 months, and 24 months. All right, so basically they're taking big fat, they're processing it, making it into the matrix, and filling it with syringes. It comes as 1.5, 3, and 5 cc syringes. Doesn't need to be mixed like other materials, Sculptra or whatever, but it can be diluted if you want thinner dilutions for a very simple area or a small and thin area, you can dilute it. All right, so basically the offerings are, as we said, into the 1.5 cc matrix or 3 cc matrix, and then also there's a 5 cc, but I'm not sure if it's available in the UAE or not. I have tried the 3 cc on hands. The patient is here. She's a relative of mine, actually my sister. We've done it before Corona, 14 months. We did it February 2020. And when I told her we're going to do it again, she was very excited, and she's here, and we're going to do a live demo on her. So the prominence of the veins, she's very thin, so the prominence of the veins, very thin skin, and she looks not filled, but just refreshed. And that's basically what she likes about it. Possibilities are all of this. It could be used in the face, you know, judiciously, of course. We're not there to overfill. It's not a fat transfer. It's basically improving the quality of the skin and making it thicker, unless you go to boluses to fill divots or complications of previous liposuction, for example. Some people were getting steroid injections in the butt, and they end up with a hole in that area. Instead of taking fat transfer and putting it there, you can try that, which is a very nice. So like lipodivots or, you know, injection divots in the buttocks. For the breast, where they do sometimes a biopsy of that special area, whether it's a needle biopsy and it leaves a mark, you can use it, because we're not injecting material. We're not injecting PLLA, we're not injecting any other type of injectables where it will turn into a fibrotic tissue and then can mask an ultrasound or an MRI even. So by lightening up on MRI, it will not light up white light, what Dr. Basil had showed us. All right, so the 4 doctors that were, you know, approved for this are dermatologist, plastic surgeon, facial plastic surgeon, oculoplastic, which I believe everybody in this audience is there. It's not for, you know, nurses or visitors from other countries, you know, injecting and leaving, and, you know, leaving us with complications, as it's becoming much more common these days. You know, at one time those disappeared, and now they're back in vogue. I'm not sure if you guys are seeing those or not. And where do we apply them is on all of these we talked about, and not in the lips, not in the glabella, definitely on the submuscular plane, and not in the periorbital area. So, for example, for nasolabial fold, you know, we use needle rather than the big cannula, and it could be, these are not by patients, so, you know, this is courtesy of Privet Aesthetics, so it's showing improvement up to 42 weeks, filling of the mid-cheek area for somebody who does not have fat to improve. It's showing, you know, 4 cc's per cheek area. Post-trauma, you know, it can improve the quality of the skin. This could be a nice thing to do after permanent filler removal, where somebody does not have fat to transfer, thin patients, and we have some of those. I'll be using it as, you know, a future for when we remove these patients. You know, this is temple cheeks nasolabial fold, basically full facial rejuvenation over time, using it, you know, in increments, not the 15 cc's were placed immediately in one area. As we said, for biopsies of the breast, you know, it can be a nice treatment and injection of 9 total cc's over 6 weeks interval. Okay, so this is before and 9 months after you know, 3 sessions. Post lipo, small areas. You know, I've tried PLLA or Elancé. You can feel it and it looks nice, but when the patients are feeling it, it's very hard. And I just had a patient from Korea 2 days ago. She had the liposuction done, and they left her with different scarrings. And, you know, many doctors told her, you know, we only can do fat transfer, and she does not have any of fat. She went to Korea, and they placed Elancé 2 years ago. She looks very good, but she goes, doctor, every time, you know, she's trying to get married, and, you know, she goes, I feel very uncomfortable when somebody touches my stomach. It's just hard. And, you know, what can you do? So we're going to go to collagenase, you know, try to soften it, and then if the devils come back, we're going to use to something like this. So these are just, you know, things we think about, and, you know, that could be very helpful. You know, tethered skin, you know, whether from a previous entry hole for endoscopy or laparoscopy or, you know, gastric sleeve, whatever it is, it could be very helpful with subcision or without subcision. Don't do them at the same time. Subcise first, let it heal, and before it sticks again, inject the Renuva. All right? The posterior thighs, depressed scars we talked about. Hands we will demonstrate today. Slight improvement in the quality of the skin. Yes, it's not for really augmenting, getting a Kim Kardashian butt, but it will improve the quality of the skin. You can combine it with Endolift, you can combine it with other material, but you know, we can separate the treatment, not all at the same time. All right, this is another liposuction depression that is showing. And of course, these, you know, could be very traumatic and psychological for the patient. Subcise and fill and get like this. Patient will be very pleased. All right? And as we said, this could be a injection given for an asthma attack or whatever with steroids, and you know, they come back and they fill them, and this is about 3 cc's 10 weeks later. Knee injury, you know, from depressed scar, and you can fill it like that. So this is basically what it is all about. It's not a filler, so it's not nothing exogenous to the body. For example, launch of Sculptra was a few weeks ago. They tell you any immunocompromised or immunologic actively patients, whether it's thyroiditis, whether it's lupus, or whether it's like that, do not. Okay, so it's not a stimulatory filler. It is an extracellular matrix that will just invite the body's own fat cells if the body has fat, not somebody that's, you know, anorexic and expect it to work when they have zero fat balance. Thank you very much. So we can take questions, and then I think we're going to do a live demo for dorsum of hands. When we are injecting the dorsum of the hands, or whether we are going for fine wrinkles, you know, usually pick your cannula. It's better, you know, since we don't want to canalize any of the veins. Cannula 22 could be done. We can do pure local at the entry site. Or if the patient is tough enough, you can do it with the EMLA cream, put 30 minutes or 45 minutes before. Questions? All right, Ms. Marina, shall we go to the next level, or? We have one more lecture. Okay, well, one more lecture. I'll get introduced the last lecturer. There's a microphone.
Good evening, all. I would like to invite Dr. Bruno Andreoro. He will speak about spherofil cell, the latest technology for the treatment of cellulitis. Please, doctor.
Okay. So, first of all, thank you for the kind invitation. I am very glad to be here. At the same time, allow to me a little joke, because I'm a big tension tonight for the European football match, since Italy will play against Spain. So I'm happy, but at the same time in big tension for this match tonight. Forza Italia, yes, finger crossed. So tonight I'm here to speak with you about spherofil cell. A spherofil cell is the new technology to treat the cellulite. But what about the cellulite? It's not a treatment for the cellulite, but it's the treatment for the orange peel skin, the treatment for the holes due to the cellulite. Can you start with my presentation? Okay. I'm Dr. Brunoro. I'm the health director at Italia Academy. And again, tonight we are here to speak about spherofil cell. Spherofil cell is this new medical device. As you can see, is nice, let me say, medical device in terms of aesthetic, but at the same time, the most important thing is absolutely portable. Is not heavy, is a light medical device, so also for the doctors that want to have something portable to treat the patients in all the outpatient setting, this is possible thanks to the size of a spherofil cell. And as I told you, is the first medical device in order to treat the fibrotic cellulite using this specific technology that is the radio frequency radio. And as I told you, we are considering this treatment as something not curative for the cellulite, but it's a treatment for the orange peel skin and specifically for the matrix skin, so the presence of the holes. And I will show you how it's possible to treat these blemishes. First of all, just a few words about the cellulite that you know perfectly. Cellulite is a very big issue. Is probably one of the most important enemy for the women. And why it's a big enemy? Because it affects 90% of women during the life course. And we know something that is very interesting, that is related to the etiology of the cellulite. The cellulite is a multifactorial disease. First of all, you know it's a disease. It's not just something aesthetic. And the primum movens, let me say, the first thing is the presence of a microvascular damage. So all starting from the microvascularization. And due to the presence of this damage at the level of the microcapillarity, microvascular, we can observe also the presence of glucose in the interstitial layer, in the interstitial space, and the glycation of the collagen. It's something very similar to what's happened when we talk about the ages, the advanced glycogen and proteins. And unfortunately, due to the presence of this glycation of the collagen, we observe as the following steps the deterioration of the skin, the deterioration also of the fatty tissue of our patient, and it happens that the collagen fibers become very hard and start to bride literally the fat. And we observe let's say, day after day, the presence of these adipose crests into the skin. These adipose crests with the collagen fibers, the fibrotic septum, conduct to the presence of the holes on the skin. And this is what I was talking about. So the migration of the fat into the dermal area, and we observe as a final condition the presence of the orange peel skin, and in the most severe cases, of course, the presence of holes, depending on the size, little or big holes. Other causes of the cellulite, of course, are the diet, the lifestyle, the presence of the hormones. This is why it's more frequent in women with respect to men, and of course something also genetic. But it's not just something aesthetic, as I mentioned before. It's also something, unfortunately, important at level of psychology of the patient, since it may affect also the self-esteem and also the advertising images of the patient. Summarizing, we can say that we have a multifactorial disease, very difficult to treat. For sure, we can use different strategies to treat cellulite, and at the same time we have a lot of steps, and these steps conduct to the presence of the cellulite for sure, but also the most severe form of cellulite. In terms of, let's say, treatment that we have available, sure, we have something that we have to ask to our patient. First of all, adjusting the diet, the mesotherapy treatments, of course, also the lymphatic drainage massage that are something due to treat the cellulite for our patient, but also the use of the shock waves. Let me add also the new technology as it is for the use of the microwaves, medical microwaves to treat the cellulite. And for the more advanced stages, we have also the opportunity to use some surgical treatment. That is this for the liposuction, the lipolaser, and also, of course, the real surgery. But today we have also the opportunity to use this new medical device, very mini-invasive medical device. Is the spherofil cell. It's designed to treat the fibrous cellulite, that it means especially the stages 3 and 4. So I'm talking about the fibrotic sclerotic cellulite, where we have the presence of the holes. How is possible to treat the holes of cellulite and orange peel skin? Thanks to this new intracutaneous radiofrequency radio probe. Again, this is the medical device, and the probe you can see on the right. It's possible to attach to the electrode needle also a syringe, and we will see how it's possible to fill the syringe. Again, we have a lot of treatment. It's important for the patient to follow the indication of the doctors. Again, adjusting the diet, use also of the different kind of treatment. But what is absolutely new in the treatment of the cellulite is something that can give an immediate result to our patient, because the treatment of the cellulite is a long treatment. Is not something that is possible to do today for tomorrow, of course. And sometimes our patient asks to us something that is fast in order to obtain some results. And the response to our patient could be spherofil cell in this case. So some technical and operative features of the machine. We are talking about a monopolar needle electrode that is, of course, associated to an adhesive patch in order to close the circuit, since it's a monopolar one. And we have the possibility to attach, again, to the probe, this electrode needle. The size of the needle are different depending on the type of holes that the doctor is treating, that we are treating, and of course also the preference of the doctor using a bigger needle or shorter one. So in this case I'm showing to you the standard needle that has a length of 5 centimeters and the diameter of 0.70 millimeter that you know is very close to 21 gauge. And of course it's a single patient, so monopatient disposable. Again, what is the peculiarity of spherofil cell? The use of the radio frequency radio. Radio frequency radio is a specific radio frequency, medium, we are talking about medium waves in this case, and it's a radio, it's able to emit AM broadcasting radio waves. What's happened? That we have the emission of the radio frequency radio just on the tip of our needle. That it means that along the length of the needle there is no emission because the needle is covered by Teflon. So it's very important to know this point, because in this way we can have micro-heating just on the tip of the needle and not along the course of the needle. This is very important in order to avoid the thermal damages. And of course, just to anticipate some question about it, it's not possible to reuse the needle. It's not possible to disinfect the needle and to reuse because of course, the use of benzalkonium chlorure or something in order to disinfect the needle can damage the Teflon. And as I told you, we obtain in this case a micro-heating that is generating very close to the collagen fibers, very close to the fibrotic septum. And what we obtain, the weakening of the collagen fibers. And thanks to the specific shape of the needle, that is a cutting needle just on the tip, we are able to cut, really to cut the fibrotic septum. But it's not all, because the micro-heating, it's able to not just to weaken in the collagen, of course, but to increase the enzymatic activity, to improve the cellular reaction. So this is something that is known in biochemical books, let me say,